Everybody ready? Best part. We haven't met before. I'm Dr. Jerry, founder of our clinic. Do want to appreciate your time tonight. I know you took time to be here. The reason we started a group is very simple. What I'll show you tonight are both normal and abnormal x-rays with the intention of when you either go over with Dr. Johnny or with myself, when you look at your x-rays, you should know, number one, exactly what you're looking at, and more importantly, how that affects you and your health. Because I will say most people come see the chiropractor in some sort of pain. So headaches, neck pain, back pain. So it surprises people sometimes when they sleep better, or the reflux goes away, or something that you might not normally go to a chiropractor for improves. The reason it improves, and the reason I would say it improves here more than maybe somewhere you've been in the past, is when we look or analyze your x-rays, we design a specific program to get the maximum amount of correction so that you really get a long-term improvement. Now, I will tell you, I went to the chiropractor. I was one of those few people who went in no pain. I went for asthma. And not asthma I had my whole life, but asthma that was developed after a weightlifting injury. I had one of my best friends drop a 125-pound weight bar on the left side of my face. Now, as you might imagine, it was an accident. It was almost 20 years ago, but I was at the Freeport YMCA, had a spotter just like you're supposed to, handed him the weight bar. He caught it, but like how most accidents happen, somebody called his name, he had turned, hit his hand, rolled off. I had also turned and started to sit up. It landed right here. It hit hard enough that it smashed here and then it bounced. I was scarred here on the top of my forehead. Ambulance ride and a CT scan later, they showed 7 different fractures. I was completely unstable. I had titanium plates inserted, so I had titanium from my jaw, through my nose, up into my forehead and over the ear. And over here, when it was still called Rockford Memorial, I had a 6.5-hour plastic surgery. And one thing I would say, I feel like they did a pretty good job. I haven't had anybody notice. It's all fake. It's reconstructed. In fact, within about 3 weeks, I looked fine, felt fine. In fact, my surgeon had said, you'll never have another problem from this injury. And I can tell you, I never have. Now, what did happen, or the unfortunate part of him catching it briefly, was it gave me enough time for me to start to sit up. And so when it hit, it didn't just fracture my face, it gave me whiplash. Now, most people are very familiar with whiplash, like from a car accident or maybe concussion, a sports injury, something like that. But what whiplash is, if you're not familiar, is it overstretches or damages the ligaments, and it doesn't allow for the ligaments to keep the stability that your spine would normally have. And so what inevitably happened was my spine shifted out of the normal alignment. It started to put pressure on the nerves in the lower neck, which for me, instead of having neck pain or headaches like you might normally think of, I went to Sprint about 4 months later and had such a severe asthma attack that I couldn't exercise until I saw a doctor and a specialist and got an inhaler and then a rescue inhaler and a steroid pill, all these things just to be normal. It was a very negative process. It took 12 doctors to get it to the point where I could go back to playing sports or exercising. But I bring this up solely because like you're all here to see your x-rays. The 13th doctor I finally saw was the very first chiropractor. And in the x-ray they took, instead of the normal 45-degree curve that you have to have, by the time I had seen that doctor, which was 8 months after my injury, my spine had shifted from wherever it started to -11. Now you can imagine if your neck is bending the wrong direction, it's going to pinch the nerves. Now, when I use the word pinch nerve, most people think of a pinched nerve directly equating to pain. And certainly it does. But what many people are unfamiliar with is that only 10% of your nerves feel pain. So you could have a pinched nerve and be miserable. You could have sciatica or headaches or something like that. You could have a pinched nerve and have asthma. It just depends on what part of that nerve is being pinched. So if you think about this, and one thing that my chiropractor said to me that I hope really resonates or that you remember is they said, our goal is not just for you to feel better, but ultimately for your body to heal itself. That's how you get that more long-term improvement. So I'm going to use a few examples here. So the upper part of the neck, this is the only part of your brain that does extend into your spine. It's your brain stem. And so there's more symptoms from a pinched nerve in the upper neck than anywhere else. You can get headaches, migraines, sinus and allergy problems. We see tons of little kids that have chronic ear infections. In adults, it can cause vertigo. It affects your sleep. It can affect mood with serotonin release, all sorts of different things. The middle of the neck affects the thyroid, so it can affect your metabolism or your energy levels. The lower neck goes to the lungs like it did for me. It also goes to your heart. Same nerves go down into your arms and hands. So if anybody, especially if you have it in both sides, but numbness, tingling, burning in the hands, very often it's a pinch in the neck, not necessarily carpal tunnel. But if you've ever heard somebody say, I hold my stress in this part, if you ever think, why do you hold your stress for one person here, another person here, in different areas? Well, think about if your body's inflamed or stressed, it's going to show up in the weakest spot. So when somebody holds their stress in their shoulders, it's because that's the weak spot. That's the part that's previously been injured, or that they, sit at a desk and look at a computer, or whatever it might be. As you might imagine, going down to the middle of the back, it can affect the digestive organs like reflux or indigestion. The lowest part of the back, more digestive organs, but also your reproductive organs, adrenals, kidneys, bladder, ferment, the prostate. Now, the lowest part of the back is the most common area to wear out as people age. So wear and tear, whether that's physical labor or sitting at a desk, in both cases, the lower back is the most common area to get a disc bulge, to have arthritis. Now, the nerves in the lower part of your back, just like your lower neck goes to your arms, your lower back goes to your legs. So we see lots of people with sciatic pain. Very rarely is it actual problem in the legs. Sciatic pain is a problem in your back. It's a pinched nerve or multiple pinched nerves in your back. The second most common area to wear out is the lower part of the neck with those same issues. So, like I said, hopefully you can see why chiropractic can help more than just for pain relief. But the very last statistic that I'll share with you, it just goes back somewhat to the why. So if you've ever thought, like, why do I have this problem now? Very frequently I hear somebody say, it was all downhill after 35 or 45 or 50 or, whatever it might be. If you think of your body in terms of function, if 100% function is perfect health and 0% is death, on average, you have to lose about 40% of the function before you'll feel a symptom. So think about it. By the time somebody gets a physical symptom in their body, on average, the problem's all the way down here. Now, your body is a self-healing, self-regulating organism, so I'm going to make an assumption, but I'm guessing everybody in this room has had a problem or had a symptom, left it alone, and eventually your body healed it. I mean, it happens. But the thing is now, if it doesn't go away, the most common thing, over 90% of people in our country go see their medical doctor first. Now, and that's fine, but think about the cost versus benefits. Now, in America, if you have a heart attack, a stroke, if you're in a car accident, America is the #1 country in the world for likelihood of having your life saved in a true emergency. Unfortunately, if you have a chronic problem, a problem that you're going to medicate with or manage the symptom with, America consumes more medication than any country in the world by a lot, and has the overall dead last for any first world country in actual health. So you think about that. If drugs could fix it, clearly, I don't think anybody would be here if you could really fix it with simply taking a pill. Now, I think most people understand that, so I don't like to spend much time on it, but really the point is covering up a symptom still allows it functionally to get worse. And nobody means to do that, but it's not a good choice on a way to live. Now, there's two phases to chiropractic treatment when you think of function. The first phase is to feel better. The majority of people, again, come in because they're in some type of pain. And you'll feel better fairly quickly. The majority of people feel better in the first or second in treatment, but within 6 weeks, 99+% of people make a significant difference. Stronger, better, all that kind of stuff. Now, think about if you base your health purely on how you feel, as that function improves, if you stop what's fixing it, but keep many of the things that are causing it, like your job or your workouts or your lifestyle or whatever it might be, for most people, it doesn't take that long to come back. And this, I see too many people that live in a level of health like this, where they get better, they get worse. If you've ever known somebody that goes to the chiropractor only when they hurt, that's what they're doing. They're doing something like this. And so this is why we see so many people, unfortunately, after they've had back surgery, after they have major arthritis, after they have these more serious problems that develop over decades because they just live in that, unfortunately, less than ideal function. Now, the reason, if I was going to be simplistic, the reason why we ask you to take the extra half hour tonight is very simply the treatment plans that we'll go over are going to get you as close to 100% function as is physically possible. From there, you decide if you want to maintain it, but at the very least, you're going to get exactly what you came for. You're going to get that result. So the last 16 or 18 minutes here, we're going to go over the normal and abnormal x-rays. We're going to start right at the top. There's about 11 x-rays total, so we go fairly quickly. Feel free to stop me at any time if you want me to explain more, but we're going to start with a couple things here. Teeth are here, back of the skull. That's a perfect 45-degree curve. A neurologist once called that curve the arc of life, most important curve in your spine. The reason it's the most important is also right here. It's closest to your brain. So for your brain to send a signal to your big toe, colon, heart, most of the signals, they go right through there. Now, in my opinion, possibly the best example of this is Christopher Reeve. Out of curiosity, how many people remember Christopher Reeve? So remember, it's typically age-based, by the way. So if you remember, how was he paralyzed? Horse, yes, fell off horse. So he played Superman in the 70s, so that's probably why you don't know him. But Christopher Reeve was bucked off a horse. He snapped his head back and broke his neck right between his first and second cervical. The reason I bring it up is he was paralyzed, and everybody knows somebody who's paralyzed, but he's just a good example. So you think of, he never moved his arms or his legs, but if you think of somebody who's paralyzed, or if you remember Christopher Reeve, and I'm going to show you a picture, they age very quickly. In fact, if you want to, you can buy Christopher Reeve's book. His autopsy report's in there. In his autopsy, it says he aged the equivalent of an additional 30 years in the 9 years he was alive. Now, since it's been a while, everybody knows what Superman looks like even. Now, this is 9 years different. Everybody agrees it looks a lot older in the second picture. So think about, by damaging his spinal cord, his brain can't communicate with his organs, and therefore he ages faster. Now I bring this up not because anybody in this room has a broken neck, but what they've shown, research shows that the normal curve perfect is 45. If you lose anything more than 50% of that curve, it will stretch or elongate your spinal cord, and over time it will thin, therefore accelerating. Now, I'm a visual person, so if anybody, two rubber bands are the exact same, one's overstretched, which one's gonna break? Right? This is about 8 weeks we've had this on there. You can already see it's starting to fray, it's getting thin. And again, you don't see that, but I'll show you in these next couple of examples, you'll actually see as the spinal cord thins, all the other problems develop with it. Now, two other things to look at. I mentioned the brainstem extends down into the spinal canal. You'll notice these two bones look different than the rest. They have to be parallel to the skull, almost like a plane's taking off, with large open spaces. That's normal. Lastly, disc spaces. Most of you have heard of a bulged or herniated disc. Discs feel nothing, but the nerve comes out right behind where that disc is. So I can give you an example. Now, discs are the pads between the bones. You can see how the nerve comes out here. Straight from the front, 45-degree curve, level hips. Now, what they've shown, or research shows, that your discs should last about 140 years. So they should outlive you. People shouldn't have all this arthritis and degenerate. But the reason that that happens is called subluxation, or misalignment of the spine. So I'm going to use a simplistic example, and I do understand that these are somewhat rhetorical questions. But let's say you fell off your bike when you were 8 and you really jammed your hips and you look like that. Can everybody agree that that's not going to be good? Especially you grow up, you play sports, you sit at a computer desk, whatever it might be. Over time, your back's going to wear out a lot faster like this, right? You lost the curve. Now, at some point, it takes about 25,000 bad motions for that disc to bulge. Everybody see the big red thing there, how that's bulging? So you can see how it would pinch the nerve to have a bulged disc. Now think about, traditionally, if this happened, and this happens to plenty of people, if you start to have back pain and it's more than you can handle, so you take an ibuprofen. Let's say I used to belong to a running club, like somebody always had a bottle of ibuprofen because they knew they were going to hurt if they ran, because they're pounding on an uneven back. So you take ibuprofen, it allows you to power through, but doesn't fix it, right? You could have it get really bad. You could go in and get a steroid shot, which will reduce the pain, but again, allows you to actually injure it more. Medically, or surgically, you could cut it off. So they can go in with a tube and cut this off, which will buy you some time, but everybody knows what's gonna come back. And lastly, if it gets really bad, and sometimes this is necessary, you can go in, cut their spine open, fuse it with rods and screws and spacers and all that kind of stuff, and relieve the pain for that segment. But there's a reason why, if you have one back surgery, depending on your age, in America, you'll have between 3 and 5. Now, you know why. It never, ever gets to the root cause of the problem. So what I'm so probably most passionate about is, when we look at your x-rays, what we're really looking at is, how do we do this? How do we do this again? It's the only way to really get a long-term improvement, is to correct the cause. Now, as we shift here, I'm going to show you the 4 different phases of degeneration or subluxation. So again, this is normal. See the curve, nice big disc spaces. This is a cadaver. So you're looking at the disc, the bones, and and the spinal cord. One thing to point out in the spinal cord, you see the space here, and then you see how much extra space there is here. Look at the difference if your neck's straight. Everybody notice how it pinches? Notice how much less space there is? Now, you may or may not feel this in phase one, but it will not correct on its own. So eventually it's going to lead to problems. Phase two, this takes 10 to 20 years to be at this point. So this part's normal. Can everybody see how this is starting to degenerate? The discs are getting thin. You're seeing bone spurs there. Early stage arthritis, like I said, 10 to 20 years to be there. One thing, so arthritis does grow forward, but remember the nerve comes out back here. And do you notice how the arthritis also grows backward? So as people start to get arthritic, you hear them say, like, I can feel the weather. They ache more. If they do a little bit more labor or something, they hurt more quickly. Well, look at how much more quickly it's going to pinch the nerve here. Now, the good part is in phase one or phase two, fully reversible. So you can completely correct that. In fact, you often can correct it much faster than it took to get there. I like to give the analogy of braces. We all probably know somebody who's had braces on their teeth. So
Just got mine on.
Okay, so how many years do you?
I had them 2.5 years.
2.5 years. So the national average is 2 to 4 years, $6,500 to fix your teeth, your smile, whatever you want to call it for that. But your spine is very similar, but it's faster. Typically within 12 to 24 months, you're going to see the overwhelming majority of the correction. Now, keep in mind, you're not going to see it, a 2-year plan here tonight. What we're going to do is that corrective plan, which ranges anywhere between 4 and 9 months, depending on the severity of where you're at. Like I said, it will get you the symptomatic relief you want, the majority of the correction, and then from there, you decide about continuing. But that's what we'll go through with you tonight. Now, phase 3, this is what's called late stage arthritis, or if you've ever heard somebody say they have a degenerated or degenerating disc. So can everybody see how gnarled or gnarly these bones look through there? Now, if you look over here, you can see how they're, so discs repair with movement. If there's no movement, they're going to wear out. They're going to thin. Now, you'll also notice the spinal cord is starting to thin there. Now, one example that I think is pertinent, if you've ever heard somebody say, I think I just have a bad back because my mom had it or my dad had it. There's certainly genetic predispositions, but think about it. These two discs have the same genetics, one wore out, one didn't. And so there's still factors that you can control, which is keeping the mobility or the motion in those joints. Now in phase 3, you can still see excellent changes, even as bad as that is. 80+% is typically what we see. I have seen 100% symptomatic relief, but probably just as importantly as the symptomatic relief is you're going to stop the arthritis from progressing. And as everybody knows, whether we want to think about it or not, your health is never going lateral. It either gets better or worse. And so if you don't do something about it, or you continue to medicate or cover it up or power through or whatever it might be, it can fuse. And now this is not a surgical fusion, this is a degenerative fusion. So the whole bottom half of this person's neck is fused. Notice you can't see the discs in the front anymore. Now, I'll tell you, we see this very rarely. So far in 2021, I've only had 2 people come in the first 6 months that have had this. But think about for just a second. Now, I mentioned the spinal cord. Notice how thin that is. When somebody's in, this takes 40 or more years to be at this point. And I bring it up not because anybody in this room has it, but so far, every single person I've treated, we tell them we can't fix that area. So often they don't start treatment. But they also, there's nothing you can do for it surgically, so you're literally going to manage the pain or manage the problem. I have yet to see somebody that's fused like that that's not on at least 10 medications. They're so sick, they're in so much pain, and when we tell them we can't help, there's frequently something along the lines of, I knew it, or I was afraid of that, and then often there's a but. Could everybody fill in the but? But I was busy, but my kids were little, but finance, and I'm not saying those buts aren't a reality, but the flip side of that is everybody knows their health is supposed to be the top priority, and when it's delayed too long, it's easy to put it on the back burner sometimes, and in these situations, that's when people really, really pay for it. Now, as we shift, we're over halfway through these x-rays. Here's a progressive loss. So this is the one you saw at the beginning, everybody recognize that one. Partial loss, full reversal. This is a whiplash. If you haven't seen, see how it's bending the wrong way here. I show these 3 people also partially for their age. Dan, I adjusted him on Monday. He's 64 years old. He retired last year. He's as healthy. He's been coming here 8 years. 7 of those years he's looked like that. his blood work's normal, he's on no drugs, by all medical standards, he's a healthy person. He often, I always say, he just like talks about the Packers or the Dodgers, he lays down and gets adjusted, he goes on, he comes in every other week and he maintains fantastic. Joe right here, he just turned 82. That X-ray he was one of my first 100 clients that I ever met. His wife was one of our first 20, right when we opened 10 years ago. And he just wrote, enjoy retirement. And so I would say, think about, for many, what's enjoying retirement? You know what to answer, but think about what's enjoying retirement. And so what I can tell you for him, he raked his own, he did his own spring cleanup. He goes fishing, he golfs, he exercises, he does all the things he wants to. He doesn't do all these doctor's appointments. He just comes in. And so while his wife pushed him in the beginning, he's been coming in for so long because at 82 he's doing that and many people aren't. Sarah right there, she's 17. 17 years old, she's the only one on a bunch of meds, she's on 4. Notice how her top bone is so much flatter than the other two. Notice the space difference. She gets migraines a lot, 3 to 5 a week. She's on a drug that's supposed to prevent those and she still gets that many. She has allergy and sinus problems that a doctor put her on medication for. She gets a ton of neck pain, takes Advil or Tylenol every morning. And the only reason we met is her neighbor. But here's the thing. If you look here, notice that she's got stage 2 arthritis right there. So does he. They're 55 years different in age. So it's not necessarily how old you are, but how long a problem has been there. Now, the cool thing for her, especially being younger, we started to work on her and she sees change very quickly. So I'm going to point out 3 things. First of all, notice the difference in the space up here. She went from 3 to 5 migraines a week down to 1 her 3rd month. She went from excruciating neck pain down to the point where she rarely takes pain meds. And remember how we talked about discs can repair with movement? Do you notice how much better her disc spacing is in the second X-ray versus the first? So that completely stopped the arthritis and even partially reversed the stuff that wasn't permanent. Now, that's the difference when you go through a corrective process. Now, the corrective process or corrective program, there is something to it. It's, you think about braces. Braces, you're paying a professional to glue metal to your teeth and then tweak them, and you know how long. Everybody knows somebody who took their braces off too early or didn't wear their retainer, right? Over time they go back. Think about why that happens. For your teeth, there's a variety of things, but essentially it's the stabilizing structures. With your spine, when you align your spine, you're not just setting bones into place, but you have scar tissue, muscle memory, ligaments, possibly arthritis. There's all these things that it takes to make that change. So while she made this change, this is a 9-week progress X-ray. But to get this to happen, it takes frequency. Nobody's leaving with a brace tonight, but it does take frequency. If you want to get in shape, it takes frequency, especially in the beginning. So the adults, depending on the severity, start at 2, 3, or 4 days a week, and then they taper. So if you look here, hopefully you can see why Sarah started at 3 days a week. By this point, she's coming twice a week. Shortly after that, she went to once a week. At the 8-month mark, she went to twice a month, and she's been there ever since. Now, Sarah's 17 in this X-ray. She just turned 22. She just graduated from college last month, and that is her 5-year X-ray. Now, I mentioned 45 is perfect. An acceptable range is between 35 and 50. She's at 37.9. Within 6 months, she got off her sinus and allergy meds. She's never gone back on the migraine meds. She doesn't take painkillers, and she's lived a completely different life the last 5 years. But to accomplish that, of course, it took some intensity in the beginning. But I can tell you, you think about, what if she didn't? Now, somebody this sick or in this much trouble at 17, does anybody just think, man, somehow she projects this beautiful, healthy life? Not very likely, right? But by making this change, we certainly expect it for the rest of her life. That's completely different. Now, last thing we're going to go through, we only have 1 more set of X-rays. This set is from the front. From the front, I only show 1 set because I think most people know your spine has to be straight, your hips have to be level. That's normal. Can everybody see just how far off this is? If you can't read the numbers, it's 10.7 millimeters drop down her hip, 14.8 degree curve, and this one's nearly as bad. That's what scoliosis is, a 20 degree curve. That's considered a pre-scoliosis curve. Now think about for just a moment what people might deal with that have a curve like that. I see you shaking your head, you know, but
A
it's
lot
like,
of pain.
a lot of pain is the most common thing I hear. Some people talk about digestive problems, sinus issue, or not sinus, breathing issues, you know. But what I'll tell you is, this is a 6-year-old. She has nothing that you would think of. And I'm gonna say the word nothing yet. Right? Because she's here because her mom is. Her mom did have a lot of pain, terrible headaches, neck pain, back pain. Her father had headaches. Her older sister had sinus problems. All of them started fairly close together. But Jane was not x-rayed for more than 6 months after her mom first started. And she wasn't x-rayed until her mom had what I like to call the light bulb effect. She sat up from an adjustment one day and said, my husband and I have talked. We've decided we're not going to wait for her to have a problem. We're going to start at a maintenance. And you know, you think about for those people that are parents or grandparents or fun, you know, how many things do we do to try and help our children be healthy? You know, and so what I say so frequently is, unfortunately, chiropractic is one of the best kept secrets for true preventative medicine because it prevents so many things. Yes, it reverses things, but like for kids, it prevents so much stuff. And so, you know, if you look at this, not only is she going to have all those something, but the only reason she doesn't, I hope your brain went back to this. It's just time. You know, it's the amount of time it takes for that to develop. Now, here's the cool thing about kids. Kids change faster, they need less adjustments. That's a 4-month x-ray. Now, keep in mind, medically, this is no symptoms to no symptoms, but if I hadn't told you anything about her and I said which person's healthier, how many people's minds go to the right? Everybody's, right? But think about it, if your mind goes to the right, think about what that means. It means that a properly aligned spine takes pressure off your neurology, which not only alleviates pain, but helps your body function better, helps your immune system strong, helps you prevent disease. It is very much that straightforward. So I show that because so frequently people, when we go back to show their x-rays, they want to talk about their spouse or their kids. So what I'd ask you to do right now is to mentally shift back. We're going to go over your x-rays or that of your spouse. When we go over your x-rays, we ask just a couple things of you. Number one, care about yourself. Make your appointments, follow the recommendations. You'll see the results you want to, but you have to be here. So we sincerely ask you to only get started if you're able to make that prioritization or commitment. The second thing is tell people what you're doing. I'm sure you all do that, you know, but when you feel like this is a great place to be healthy, tell them what you're doing. The reason we keep that exam and x-ray portion to a flat $25 is because we never want cost to be a reason that stops somebody from coming in to at the very least check it out. As a finisher for tonight, this is your last long appointment. You'll never have an appointment like this where you need to be so specific on time and sit in this room. The rest of the days, we're here 6 days a week. Average appointment time is 20 to 25 minutes. You set the days and the times, and it's incredibly flexible. In just a moment, staff members are going to show you into private rooms to do your x-rays. There are 2 doctors showing. It typically takes anywhere from 5 to 8 minutes to go over the x-rays, so everybody should be done here within about 15 minutes. Okay? Perfect. Thanks for your time. Thanks.
Thank you.
So you can go ahead and come with me first.
Okay.